Talk about detox. I hate how batty and buzzwordy detoxes are. Because here's what most people do on a detox. Okay, for the next 10 to 30 days, I'm going to eat the way I should. And then I'm going to quit, right? That's not what we should be doing with a detox. We should, of course, be eating well all the time. Okay, now that we've gotten that cleared up, let's talk about detoxing. Now, what we're trying to do is we're trying to help the liver take toxins and put them into a different form so the kidney and the large intestine can then get rid of them. Now, people love talking about the liver, but they forget about the other two. You can take all the detox herbs you want, but if you're not pooping, you're not getting rid of them. In fact, you might be giving yourself a large intestine condition like IBS or Crohn's disease or something along those lines. So, step one, you need to make sure you're pooping. Before you ever start doing a detox, let's make sure that we're getting enough water in. The secret to pollution is dilution, okay? So we need to be drinking lots of water, and if you're not pooping, well, maybe we shouldn't detox yet. So increase the water, increase the fiber, and just start eating real food, and your body will naturally start detoxing through the large intestine. Now, why do some people feel like garbage on a detox? Well, let me tell you. Your liver, so you start upregulating your liver function with all of these herbs, with all of these chemicals that you're taking, but your elimination process, i.e. your kidneys, can't keep up with it, all right? So you're taking all these toxins out of your fat cells, out of your tissues, you're putting them to a water-soluble form, and then they're backing up in the kidney, and your blood gets toxic because the kidney cannot excrete them properly. So before we do any sort of liver detox, we've got to make sure our kidneys are healthy. Now, that's a hard thing to know. What are the main symptoms of a kidney that's not healthy? The most common one is going to be chronic low back pain and chronic bladder infections. Okay, so if you have chronic bladder infections, and I know a lot of you do, and just real quick, the symptoms of a bladder infection are not just burning when you pee, but you gotta pee all the time. Or, I gotta pee and I gotta go pee right now. Or, I dribble when I cough or sneeze or jump on a trampoline. And I know a lot of you ladies are saying, well, I had babies, so that's why. No, that's not why, because lots of women have babies and don't have those symptoms. Okay, these are bladder infection type symptoms. And of course, the low back pain. So what do we do about that? Well, the kidney needs a good amount of salt. It also needs a good amount of vitamin A. Okay? So if you have any of these symptoms, we got to get rid of that kidney problem before we get rid of that liver problem. Okay? Now, let's talk about liver detox. Now that you've figured out, okay, I'm pooping good, I'm peeing good, I don't have any bladder infection or low back type symptoms, now let's do a detox. So there are so many herbs that you can do on a detox. But the best one, and the most important one, is probably going to be milk thistle. Okay? Now, milk thistle is phenomenal because it's actually trophorestorative. Trophorestorative, fancy word for it, actually heals the liver tissue. Now, there are lots of other things. There are so many different detox herbs, but we've got to make sure all these things are healthy before we get into a detox.